Hello everyone. I am Professor Dr. Muhammad Iqbal Afridi, the Dean of the Jinnah Postgraduate Medical Center, Karachi, and the President of Pakistan Psychiatric Society. Let me inform you that there is no conflict of interest, and I have not taken any honorarium from GSK. And this GSK meeting has some promotional material. So we will be discussing anxiety disorder and treatment guidelines. As you all know that anxiety is a universal phenomena. Nobody is immune. I can have, you can have. And let me give you an example. We all have blood pressure in our body. If there is no blood pressure, it means we will be dead. So therefore, normal blood pressure or tension is normal, but when it is excessive, when there is a tension is increased, there is hypertension, it is considered as a disease. Similarly, when the anxiety disorder is higher in proportion, it is considered a disease. And let me tell you that Freud has given very good statement that anxiety, normal anxiety is a concern about a known danger, while pathological anxiety is a concern about a danger yet to be discovered. That means if we have there is a catastrophic phenomena, everybody will be anxious. So that will be considered as a healthy or normal anxiety. So what makes anxiety an abnormal phenomena? When it is irrational, that means when the perceived stress is out of proportion with actual threat. It means when a danger animal is in the cage and we should not be worried, we should not be anxious. Similarly, if it is excessive in amount, that is higher in intensity, so that is an abnormal phenomena. And it becomes out of control, when the person wants that I should not be anxious, but yet he is anxious, then we consider it as an abnormal pathological condition. And when it is longer in duration, that is more important. When it is longer in duration and when it disturbs the performance, that makes anxiety as a pathological, diagnostic disease entity. So how common is this condition? This very common condition. We all experience anxiety, but they are not considered an illness till they fulfill the 5 criteria of irrationality, out of control, longer duration, and when it disturbs performance. So it is said that the prevalence can be as 31% lifetime prevalence. That means it is higher in prevalence than mood disorder as well as the substance use disorder. And one thing more important, that it has comorbidity. When the person has predominant anxiety for longer time, he can have a depressive disorder or any other physical condition. And it has been said that 40% of such patients are undertreated or not recognized properly. If you look at this slide, that the prevalence of anxiety disorder throughout the world, the WHO region wise, you can say that anxiety is a very common phenomena in each and every component or part of the world, and you can see that female are more vulnerable in all the region of the WHO. So that means we have to consider this condition when a female is constantly complaining of the various bodily symptoms. We should consider this. Now let me give you one of the type of anxiety, a case presentation regarding social anxiety disorder. You can see that a 26-year-old student reported feeling very anxious when giving an presentation, taking an examination, or meeting an authority, and this is very common presentation among our youth. In this situation, he has palpitation, tremors, blushing and sweating, and he is fearful that he will be embarrassed himself. So he reports having few social contact and avoid going to parties and making phone calls, but he feels lonely. His anxieties started during his teenage and have increased considerable since he started attending a university. So how we can manage this case? So this is one of the type of anxiety, that is the social anxiety disorder. Now coming to the clinical case 2, which is related to panic disorder, that is also one of the type of anxiety which is very painful to the person because it is episodic. Here you can see a 30-year-old woman presented with daily episode of chest pain, shortness of breath, sweating and palpitation. She feels very anxious when these episode occurs and worries that she may have a heart attack, and sometimes such people feel that I become mad, or I can heart attack, or similarly can have some problem in related to respiratory. So she reports an increased avoidance of social activities and moodiness, poor sleep, and a low level of energy. Now she takes no medication and reports no drug or alcohol use. Her physical examination is normal, especially here we should consider that the person can have pheochromocytoma or thyroid related function. The general practitioner should look for that, because there are physical conditions like pheochromocytoma that can present and mimic like panic disorder. And how we can manage this case, we will come to the later component of the presentation. Now coming to the third case, that is generalized anxiety disorder. Now generalized anxiety disorder, you can see that a 46-year-old married woman present with insomnia, headache, muscle tension and backache. She described a long-term pattern of worrying about several life of situations. Now these condition, in this condition, people are worried about various domain of life. For example, they are worried that the kids is going to school will be on time or not, he or she will return on time or not. So the person is worried about various domain of life, and that include the health issue, financial issue, job related issue, and not increase anxiety. And she noted increased anxiety associated with teenagers leaving home to attend college. She drinks alcohol daily to reduce the tension and help her sleep. In viewing her history, you note that she has visited your office many times over the past years because of her physical symptom. And such patients have a lot of prescription, a lot of documentation comprising of many laboratory tests and so on. So how we can advise this, what we can advise and how can manage this case? The initial assessment for such patients are that we should ask some history. First of all, we should listen to the patient, because until we listen to the patient, and that should be with empathy, because you may have noticed, you have seen a lot of cases of anxiety and reached to the correct diagnosis, but for the purpose of treatment, our assessment become therapeutic, and that we should see that the person is apprehensive and he is worried, inappropriately fearful, complaining of heart sinking or shortness of breath. If these conditions occur, first of all we should listen the patient and then examine for the physical condition that can mimic such condition like thyroid related issue, pheochromocytoma or any other hypoglycemia and so on. When these physical illness are ruled out, then we should look at the severity. When the severity is high, we should manage differently. When the severity is less, we can assess the patient, listening to the patient, and we should treat according to various guidelines of various type of anxiety disorder like panic disorder, generalized anxiety disorder or phobic anxiety disorder. And we should also apply some diagnostic criteria. There are rating scales for panic disorder, social anxiety and generalized anxiety disorder. Then we should categorize that whether this is which type of anxiety disorder, so that the treatment can be done accordingly. So for general practitioners, because in Pakistan, India, Bangladesh, there are a lot of patients are seen by general practitioner, they don't have sufficient time. But luckily there are two questions which can be asked within a minute, and for identification of such patients there are two questions. Number one, over the last 2 weeks, how often you have been bothered by the following problem? Number one, feeling nervousness, anxious or on the edge. And number second question, not being able to stop or controlling worries. If these questions are asked by every general practitioner, he can screen easily that this person is suffering from anxiety disorder. This slide shows that what are the various type of anxiety and how we can differentiate among them. For example, the generalized anxiety disorder is excessive and pointless worries about whole range of domestic and personal issues related to kids or jobs and other things. while the social anxiety is fearfulness of scrutiny or criticism associated symptom with blushing and while meeting some people or going for presentation. The panic disorder is also anxiety type in which there is episodic severe anxiety and the person feels either having heart attack or going mad or having respiratory problem, serious problem, and they are episodics. The obsessive compulsive disorder is also one of the condition which can mimic anxiety because anxiety is very common among this. Here the person will have repeated ideation or checking, repeated head washing, and the person will consider them as senseless and they will try to resist that, but they cannot get rid of them and therefore they become anxious. So, in that condition we can see that the person is having repeated ideas, repeated acts that can be a form of anxiety which is considered as an obsessive compulsive disorder. The other one is post traumatic stress disorder. The post traumatic stress disorder also presenting with anxiety. Here the person will have such a huge stress which is beyond the experience of normal human beings such as earthquake or some disaster, and after 1 month the person will have hyperarousal or flashbacks in his mind, and therefore this condition is associated with very severe, intense, catastrophic events. So therefore we can consider it as a disease. Now the management of anxiety disorder start with that first of all we should assess the person for any comorbidities, especially the physical condition like diabetes, hypertension, and at the same time we should ask about any suicidal ideation and psychosocial stresses along with any emotional support or psychosocial support. Now once this is done and we have excluded any physical illness, then we should give advice about lifestyle, and that include that the person should maintain a good ratio between sleep, exercise, work and social activities. That we will discuss in the next slide in detail. And also if there is some substance use, because such people try to relieve their anxiety by using tobacco and other substance, so we should address that and then give proper psychoeducation in the form of disease that we know that this is a troublesome condition for you, but it is not a fatal condition or it is not a dangerous condition. If this much information is given to the patient, most of the patients are relieved, and we have to watch the patient and then choose the initial treatment in collaboration with the patient. How come? We should provide the various type of non-pharmacological therapies, whether analytical therapy, behavioral therapy or cognitive therapy or general lifestyle changes, so that the patient can be the decision maker and we have to achieve collaboratively the relief of the person with good response to treatment. And that also one should consider that therapy or that psychological intervention is available near to him, otherwise he can be in trouble. And then we have to mobilize the social support, his friends and his colleagues and similarly his family members to encourage them. Now the non-pharmacological intervention first include the good communication skill. So the doctor-patient relationship should be encouraged, and so that he can have confidence on us, and we should check and also address his concern. For example, if he is concerned about his heart, we should thoroughly examine his heart. If he is concerned about his chest problem, we should consider that, and if he is concerned about his tremor, we should properly examine that. And then we should have listening attitude, and I prefer that the patient should be given a lot of time to talk to his problem in detail. For example, the person is saying that I have indigestion or having a stomach problem. The therapist should ask what sort of problem you have. Is this indigestion, or this is heaviness, or this burning sensation, or this heartburn, what you feel? In this way we can make this assessment as a therapeutic. Then after that we should give reassurance that I know that you are having this tremors or having palpitation, but we should give a counseling to him that this is, though you are having, you are at dis-ease, you are not at ease, but these are not fatal, and generally these conditions are easily treatable. And then we should ask them to share his problem with family member or colleagues or friends, so that it is ventilated. By sharing, we can ventilate the stress. After that, advice about lifestyle. That is very important, because such people tries to control their anxiety by such things which are actually worsening the condition. For example, they try to take coffee or tea or tobacco in order to relieve anxiety, but actually these conditions are worsening the conditioning. So therefore, we should advise about diet which is helpful, like for example, milk is very good and yogurt is good, and taking the vegetables and also fruits are useful. And exercise, regarding exercise, we should be very sure that the person should not have any physical serious illness, and then he can start exercise by slow pace and increasing with time, so that he can achieve the target that he should have 30 minutes exercise at least 5 days a week. And regarding smoking, we should ask him that smoking or tobacco use, especially in Pakistan, India, Bangladesh, most of the tobacco is used through chewing or other things. So we should ask them that anything which contain caffeine or tobacco should be stopped. And the most important thing is sleep hygiene. Sleep hygiene, it has been shown that sleep is really a wonderful thing for many mental illness, especially anxiety and depressive disorder, and going early to bed and rising early, that makes a person healthy and wise. Other non-pharmacological intervention include relaxation technique, and that include deep breathing. If we ask them to focus his attention on the deep breath, inhalation and exhalation, the person has other part of the body is detached, therefore the person feel relief from anxiety. And then muscle relaxation, we can ask him to develop stress in all components of his periodically, starting from hands or from other component. He should develop a stress, because the stress is followed by relaxation. So that his mind and his body can understand that this is my tension and this is my relaxation, this is my accelerator, this is my brake, so that he can control his anxiety. And then after that, we should also encourage him to take the religious therapy according to his belief. If he is Muslim, he should go for 5 days time pray, or according to his belief he can participate in that. And the other techniques are music. Music has good impact on us, and if it is smooth and calm, it can becomes a very useful anxiety relieving activity. Sports is very good if we move, because movements increase the adrenaline, utilization of adrenaline, and similarly endorphin and caffeine are the reliefs, which are not only improving anxiety but also depression can be relieved with that. And then meditation is one other form of treatment intervention. Now for how we can manage the case, initial treatment should be based on the severity. If the person is having mild type of anxiety, it can be treated with CBT, that is cognitive behavior therapy, in which we improve the cognition, the understanding of the illness, and also the behavior, which can improve relieve the anxiety, and so that the person can relieve. For example, if somebody is fearful to talk in front of a mic or other thing, we ask him to repeatedly do that, and consider that it is not hurting, the mic will not be a dangerous thing. You should speak in normal way, normal tone, so that he can manage to have good speech. If there is the condition is moderate, that can be treated with CBT, that is cognitive behavior therapy, along with medication, or separately we can treat them. And when the condition is severe, the CBT plus medications are essential, because if we leave the anxiety unattended or untreated, that can be very damaging in the form of repeated test or repeated consultation, and also his performance. If he is in school, his academics will be disturbed. If he is on job, his job will be disturbed, which can lead to termination. So, in this way we can have the initial treatment and then review after 4 to 6 weeks. Then at least if there is partial response, we should continue the treatment and monitor progress, and also look at the side effects and address that. If the person is remission, it's okay. If there is no remission, there is no response, we should check the adherence to the treatment and review the therapeutic engagement, and we should also rule out medication related side effects which can be troublesome for the person, and review the treatment goal and expectations. Sometimes the person is expecting a lot, but it will go gradually, and check for the treatment provided with consistent guidelines, what the guidelines, how much it is reduced. If we assess with the same scale, if there is a reduction in the score, we can communicate the person that you are improving, and we have to re-evaluate the formulation and reassess the comorbidity. If the person is having depression or any substance use or any personality disorder or any physical illness, we should address that and modify treatment accordingly. Now, for the management of anxiety disorder, the initial treatment with CBT is to have face-to-face CBT or medication, and then the initial treatment face-to-face CBT and adding medication can also be another form, and the third would be adding CBT and increasing medication within the appropriate range. Generally, we have seen that the general practitioner start subtherapeutic dose of the medicine, therefore the response is not good. So, we have to increase the dose according to the therapeutic range and along with CBT. Now, if you look at this slide, that there is a variety of drugs or medicine that are available and that have been used successfully in anxiety disorder, but some of them are approved for one type of anxiety and certain are approved for another type of anxiety. If you look at the slide, and luckily that SSRIs are, although antidepressant, they are neither minor tranquilizer nor major tranquilizer, and they are very safe to be used, and they have, luckily, although they are selective, yet they are broad spectrum that not only treats depression but variety of anxiety disorder. Like for example, if you look at this slide, that for panic disorder, escitalopram and fluoxetine and paroxetine are, and certainly these drugs are used, especially the venlafaxine has been used. For social anxiety disorder, escitalopram is very good, and similarly paroxetine is very good. I have seen, and this is my personal experience, that our patients are not only having anxiety but at the same time depression. So, this is a broad spectrum medication which not only improve the variety of anxieties but as well as depressive disorder. And if you look at the venlafaxine is also having good therapeutic application. For obsessive compulsive disorder, fluoxetine is approved, fluoxamine, paroxetine has been given, and sertraline has been given. And for generalized anxiety disorder, the fluoxetine and paroxetine is very useful. And for the post-traumatic disorder, if you look the various drugs among the SSRI, paroxetine and sertraline has been approved by this and has very good outcome with this medication. And the other medications that are used, there are the tricyclics are also can be used, but they have some certain side effects. And there are certain non-benzodiazepine drugs, jaise, for example, the buspirone can be used, but that is a good drug and it has no impact or addiction. Now, if we look at our clinical case, one that was on social anxiety disorder, here the patient has asked about depression, and he or become anxious and having substance use. Now, we have to rule out the physical condition in this case. First of all, because there are certain physical conditions like thyroid related issues or any pheochromocytoma or any physical illness like cardiac diseases, that should be ruled out. And then we should go for the initial assessment, that whether it is the severity. If the severity is mild, we can go for cognitive therapy. If the person is having moderate to severe type of condition, then we should combine the CBT with pharmacotherapy, and we should choose the non-benzodiazepine drugs that are neither minor tranquilizer nor major tranquilizer. I'll encourage our general practitioner others to choose something from the SSRI, and here you can see that apart from giving certain psychoeducation, that you have to expose yourself, and you should, if the repeated exposure is there, the social anxiety will be reduced. And if we give any of the SSRI, like for example paroxetine, it will increase the anxiety, and we will ask the person that you have to expose yourself. If you are worried or if you are having problem in presentation, you should repeatedly go, because repeated exposure along with medication and CBT will have very good outcome. Cases of panic disorder, here the person is having severe episode of anxiety where the person is actually worried about having a heart attack or becoming mad or having some other physical condition. We have to listen to the patient properly, and then we should assess him according to the symptoms. For example, if he is worried about his heart attack, we should listen to his heart sound and taking blood pressure and pulse, and then we should narrate that luckily your heart is okay, your pulse is okay, and that becomes therapeutic to the person. And also we should tell about in the psychoeducation about the panic disorder, though it is really intense anxiety and you are considering it is very serious condition, but in the research has shown that it is a very mild type of mental disorder or psychiatric disorder that can be treated with the physical activity, sleep hygiene, exercise, and sometimes this condition is associated with agoraphobia or going to certain closed space. So we ask the person that you should not avoid, because such people try to avoid going to the places where they can have panic attacks. We say that you should improve your cognition and expose yourself to that area so that you can overcome panic disorder. And apart from CBT and relaxation techniques that we have discussed, the deep breathing, we can add any of the SSRI, especially paroxetine, can be given to such patient with very good result. And it has been shown that patients are relieved and they are very thankful to their doctors after few doses. And here important thing is that we should also look for any side effects in the form of if benzodiazepine are given, we should look that whether the person is having tendency to increase the medication, then we should look at that place, because generally we have seen that those who are anxious, they are not having tendency to increase the dose, but we should look for the benzodiazepine because they are very addictive. So therefore, we should ask the person that after 4 to 6 weeks we have to stop that condition and improve it with your cognition and with your behavior. Now coming to the third case, that is the generalized anxiety disorder, that as we have already said that this is a free floating anxiety for various domain of life, and the person is anxious not only for personal things but also for social things and family and jobs. For everything he is anxious, and such people try to relieve their anxiety by taking alcohol or tobacco. We should try to look at that as well. And for generalized anxiety disorder, as we said, that we have to educate the person that this is your anxiety which can be relieved with good lifestyle, like for example having proper sleep and having proper meal. There are certain foods which can relieve anxiety. Similarly, exercise is very good, and social activity, going to the various friends or sharing problems, and taking part in the sports is very helpful for such patients. And if we want to pick some apart from CBT, we can add any of the SSRI, but especially for generalized anxiety disorders, what has been approved by the FDA, you can add any of them. And at the same time, you should look for any side effect of these medication, and because SSRI is very useful, they are not only not having any addiction, but also they are broad spectrum, and they are used in variety of the type of anxiety along with depressive disorder, so that the person is relieved, and generally such patients are relieved with medication as well as good lifestyle and CBT. Now, if you look at the generalized anxiety disorder, we have very good assessment tool, that is GAD-7, and the two component we have already discussed, and that must be applied so that we can look at the level of anxiety and looking at the disability as well as assessing the suicidal risk. This is important to note that if there is no improvement, that means 50% reduction in the original symptom of this condition, and if we do not achieve this within 3 months, we should look for the other variety, that is either adjunctive therapy or changing the treatment so that we can relieve such patient. Thank you very much for your attention, concentration, and let us join hand to identify, treat and defeat anxiety disorder by all level and by all means. Thank you.